This part of the test will measure your writing ability in an academic environment. It will last around 30 minutes. You will write 2 responses. In the first task, which is called an integrated question, you will read a passage and then listen to a lecture. After that, you will answer a question based on what you read and heard. In the second task, which is called an academic discussion question, a professor will ask a question that you need to answer. Writing Task 1, Integrated Question. For this task, you will read a passage, and then hear a lecture about an academic topic. You will have 3 minutes to read the passage. You may take notes during the reading and the listening. The reading passage will be shown again during the time when you are supposed to write, but you will listen to the lecture only once. You will have 20 minutes to write your response. Effective responses are usually between 150 to 225 words. You have 3 minutes to read. Start reading now. Now listen to the lecture.
Artificial intelligence, AI, is a powerful tool with diverse applications across multiple industries. However, the application of AI in healthcare is often discussed with significant optimism, without due attention to the limitations and potential downsides. In this lecture, we will critically examine 3 often touted benefits of AI in healthcare: AI's role in diagnosis and treatment, its impact on patient engagement, and its role in post-treatment care. Firstly, while the idea of AI improving diagnostic accuracy and personalizing treatment plans is appealing, in reality, the effectiveness of AI in these areas remains unproven and contentious. AI models are trained on existing data sets, which may contain inherent biases and inaccuracies. Hence, the diagnosis and treatment plans suggested by AI could mirror these inaccuracies. Furthermore, the black box nature of AI models makes it difficult to understand how these systems arrive at their decisions, causing uncertainty and potentially compromising patient safety. Secondly, when it comes to patient engagement, AI can fall short. AI chatbots and virtual assistants may be able to provide basic health-related information and reminders, but they lack the empathetic touch of human interaction. The nuances of human emotions and personal experiences can be lost on AI, making the patient engagement process less effective. Furthermore, relying on AI for patient feedback analysis could miss important emotional and qualitative aspects that a human reviewer could understand and appreciate. Lastly, in the sphere of post-treatment care, the benefits of AI may be overstated. AI-powered wearable devices can offer continuous monitoring, but they also raise significant concerns about data privacy and security. Besides, while AI might remind patients about medication schedules, it cannot address complex human behavioral factors that contribute to non-adherence to treatment plans. Thus, the effectiveness of AI in post-treatment care remains questionable, and the promises of enhanced patient outcomes and streamlined healthcare processes might be more illusionary than real.
Summarize the points made in the lecture, being sure to explain how they cast doubt on specific points made in the reading passage. You have 20 minutes to write. Start writing now.
The essay excellently critiques the application of artificial intelligence, or AI, in healthcare by clearly presenting its thesis in the introduction. The opening paragraph effectively sets up the argument by directly contrasting the lecturer's perspective with the previous passage, laying a solid foundation for the contradictions that will be discussed. The first body paragraph does a commendable job of highlighting the contradictions regarding AI's role in diagnosis and treatment planning. It provides specific points from both the essay and the lecture, clearly outlining the optimistic view versus the critical perspective. The writer doesn't just list the differences, but delves into why they are significant, underscoring the issue of data biases and the black box nature of AI, thus enriching the critique. The second body paragraph focuses on the differences in patient engagement, contrasting the essay's positive viewpoint of AI with the lecturer's critical view. The writer brilliantly points out that the AI's lack of empathy and understanding of human emotions is a fundamental drawback that undermines its effectiveness in patient engagement. This point is well articulated, capturing the heart of the contradiction. In the third body paragraph, the writer discusses the divergent views on post-treatment care. The detailed presentation of the lecturer's concerns about data privacy and security, and AI's limitations in addressing complex human behaviors, effectively contrast with the essay's optimism about AI's role in post-treatment care. In conclusion, this essay succeeds due to its clear organization, specific and well-articulated points of contradiction, and the ability to delve into why these contradictions are significant, providing a comprehensive critique of the application of AI in healthcare.
In this task, you will need to answer a question posed by a professor. You will also be able to see how two other students answered it. You will have 10 minutes to write your response. Effective responses will have at least 100 words.
It considers not only how AR could make existing tasks more efficient, but also how it could fundamentally change human experience. This level of analysis shows the depth of thought and the ability to consider the broader impacts of technology. While it doesn't dismiss the concerns raised about privacy and cost, it makes a conscious choice to focus on the positives. It uses specific examples of how AR could be used, such as in art installations or data visualization for scientists. These concrete examples help to ground the argument in reality, making it more convincing. The response is clearly articulated and logically structured. Rather than merely agreeing or disagreeing with previous points, it adds a new dimension to the conversation. The focus on how AR could change human experience is a fresh take on the subject and adds depth to the discussion.